So let's start. Bismillah ar-Rahman ar-Rahim. So today our topic is poison and its treatment. It's the most important department of a hospital where the poisons are treated. In my service, we have a well-established Department of National Poison Control. This was the only one in Pakistan that was mostly established in 1990, and then later on it was upgraded in 2012. So we have taken the article from there. So what is a poison? So we can say that poison is defined as a substance which, when administered, what is inhaled, swallowed, is capable of acting deleteriously on the body that produce ill health or death. Again, I repeat this. Poison is defined as a substance which, when administered, inhaled, or swallowed, is capable of acting deleteriously on the body and it produces ill health and leads to death. All substances are poisons. There is none which is not a poison. So when they are not taken in appropriate strength, they may lead to poisons. Maybe of poison may of synthetic, minerals, vegetable or animal origin. The source may be synthetic, minerals, vegetable or animal origin. So WHO estimates over 30 lakh poisoning cases with 2,20,000 deaths per year worldwide. This still data has to be shown that 30 lakhs poison cases can be reported. Some are not to be reported. So how poisons enter the body? Four ways by which poison can be entered in the body. First is inhalations. Second is ingestions. Third is absorption. Fourth is by injection. So four way by which poison can be enters in the body: inhalations, ingestions, absorptions, and injections. Now, classification of poisons. Poison can be classified based on type of action exerted or based on medico-legal purpose. The two ways of classification: based on action exerted or based on medico-legal purpose. Classification based on action can be classified in 6 categories. The further 6 categories, their poisons can be corrosive in natures, irritant in natures, neurotoxics, cardiac poisons, respiratory poisons, and miscellaneous. Again, I repeat, there can be 6 further classifications: corrosive, irritants, neurotoxic, cardiac poisons, respiratory poisons, and miscellaneous. Second is your classification based on medico-legal purpose. There can be suicidal, homicidal, accidentals, stupefying, abortifacient, cattle poisons, lead, arrow poisons, food poisoning, and drug dependence. There are further 9 classes. One is suicidal, homicidal, accidental, stupefying, abortifacient, cattle poisons, arrow poisons, food poisoning, and drug dependence. Action. The first is the classification based on action. First one is corrosive. In this category, acids, inorganics, organic, and vegetable acids. In organic acids, you can know that sulfuric acid, hydrochloric acid, and nitric acids. Organic acids, the acetic acid, salicylic acids, oxalic acids, carbolic acids, and vegetable acids, hydrocyanic acid, potassium cyanides. B is the alkalis. Alkali, hydroxides and carbonates. Hydroxides of sodium, potassium, and ammoniums. Carbonates of sodium, potassium, and ammonium. So these are the corrosive poisons. Irritants. If you go for irritants, the irritant poisons are inorganic, nonmetals like phosphorus, boron, fluorine, chlorine, bromine, and metals like arsenic, lead, mercury, iron, zinc. These are the irritant poisons. Organic, vegetable and animals. In vegetables, castor oil, croton oil and seed, Calotropiste, ergot, capsicum. Animal poisons is snakes, scorpion, spiders and poisonous insects. Mechanicals, powder glass, diamond rust, hairpin, needles, nails. These are the irritants, poisons. Then third is neurotoxins. Is cerebral neurotoxins are narcotics are somniferous. Now opium and its alkaloid like morphine, codeine, thebaine, Noscapine and Narcine. Another second is inebriants which capable of intoxicating, example alcohol, anesthetics agents, either chloroforms, fuel, kerosene, petrol, sedatives and hypnotics, barbiturates, chlorohydrates, insecticides, DDT, and endrains, organophosphorus compounds like parathions and malathions, and cold derivatives, naphthalones. Deliriums, datura, cannabis, atropa, atropa belladonna, cocaine, camphors. So these are neurotoxins. Spinal neurotoxins, excitants, nux vomica and its alkaloids, strychnines, depressants, lathyrus stabians, and jasmine, peripheral neurotoxins, conium and curare. Narcotic poisons are aconite, digitals, oleanders, tobacco. Respiratory poisons known as effexants, carbon monoxides, carbon dioxides, sulfur dioxides, var gas, tear gas, chlorine, phosphine. Miscellaneous analgesics and antipyretics, antihistamines, antihistaminics, tranquilizers, stimulants like amphetamine, antidepressants, hallucinogens, LSD, food poison, and drug dependence. Now, these are the various poisons. The second one, the class was classification based on medico-legal purposes. One is suicidal. The near ideal suicidal poison are opium and barbiturates. Commonly used suicidal poison in Pakistan are arsenic, aconite, cyanide, phenols, carbon monoxide, etc. Homicide is the act of human being killing another human being. The near ideal homicidal are thallium and fluoride. In rodenticides, commonly used homicidal are snake venom, corrosive, opium, strychnines, cyanides. Accidental poisons occurs keeping insecticide at home and field, at place of work or industry, carelessness, iron storing poison, quack remedies, fraud remedies, snake, scorpion, and insect bites. Stupefying poisons means to render stupid someone. These are the poisons which alters the consciousness of persons and are commonly given for purpose of rape, robbery, dacoit, theft, etc. Can be used as dhatura, cocaine, alcohol, arsenic, cigarettes, cannabis, preparations like charas, ganja, and bhang, etc. They are foreign stupefying poisons. Abertificient. These are the poison used to induce criminal abortion. Examples are lead, arsenic, ergot, castor oil, croton oil, calotropiste. Next is cattle poison. These are poisons used to kill cattle. Examples are Abrus, Precatorius, Aconite, arsenic, snake venom, insecticide. Arrow poison. The poison which commonly applied on arrow head. Examples are curare, Abrus, Calotropiste, snake venoms, aconites. Eighth one is food poisoning and the drug dependence. Now, how the treatment has to be taken, applied. Now, first, the general treatment of poisons, you can do, how to do that one is, the general treatment is given if the specific nature of poison is not known. If you don't know what poison has taken by person. So how to do that? The condition of patient assessed by detailed clinical examination based on degree of loss of consciousness and presence or absence of other medical complications. The patient should be removed from the source of exposure. The degree of loss of consciousness is known as reads, graded by classification is known as GCS. The degree of coma is assessed by GCS, Glasgow Coma Scale. Mostly whenever you go, they ask that what the GCS level of the patient is. This Glasgow Coma Scale. Reads classification of grade of consciousness, how they determine that. One is grade 1. Patient is drowsy but responding to verbal command. Grade 2, unconscious but responding to stimuli. Grade 3, unconscious but responded only to very painful stimuli. Grade 4 is unconscious and non-responding. Further, GCS says that Glasgow Coma Scale responses eye-opening. Response scale says that eye opens spontaneously means 4 points. Eye opens to verbal command, speech or shout, 3 points. Eye open to pain, not applied to face, 2 points. No eye opening. Now verbal response, oriented, 5 points. Confused conversation but able to answer questions, 4 points. Inappropriate responses, words, listenable, 3 points. Incomprehensible sound or speech, 2 points. No verbal response, 1 point. Now motor response, because when the patient come in the hospital, how it has to be calculated is GCS scale. Now with motor response, obeys command for movement, purposeful movement to painful stimuli, withdraw from pain, abnormal, spastic, flexion, decorticate, posture, extensor, response, distribute, postures, no motor response. Otherwise, figures how you can confirm the GCS scale. Now, aim of general treatment of poison is that what to do? To remove the unabsorbed poison. First, to remove the unabsorbed poison. Second, to treat and excrete the absorbed poison. First, remove the unabsorbed poison and then treat and excrete the absorbed poison. What the steps of general treatment has to be taken? First, removal of unabsorbed poisons. Use of antidotes, elimination of absorbed poisons, symptomatic treatment, and general care of the patients. So, what the treatment has? First, removal of unabsorbed poison. Second, the use of antidotes. Third, elimination of absorbed poison. Fourth, symptomatic treatment, and then general care of the patient has to be taken. First, how the removal of absorbed poisons. So this depends on route of administration of poison. Induction of vomiting or gastric lavage is generally adopted methods to remove the poison. Second, inhaled poison. Remove patient to open atmosphere. Ensure clear airway. Artificial respiration and oxygenation can be given. For injected poison or a snake bite, use of tourniquets. Incision and suction has to be done. Ice pack may be applied. Contact poisoning. Wash the area with water or soap water. Apply antiseptic creams in case of stings. Ingestion of poisons. Induction of vomiting and gastric lavage has to be applied. Now, how to induction of vomiting has to be done. Vomiting induction is used to remove poison within 4 to 6 hours of ingestion. This method is contraindicated in case of ingestion of corrosive poison. So there risk of perforation in GI tract, chance of aspiration, ingestion of petroleum distillates.
Excuse me, sir.
जी
सर तैयबा हनीफ कब से वेटिंग कर रही हैं, प्लीज आप उन्हें
बेटा
ऐड
मेरे
कर
पास जो
दें.
सामने आ रहा है
वेटिंग
मैं
करें.
उसको ले रहा हूँ, जो नहीं सामने आ रहा मेरे पास जो आ रहा है स्क्रीन पे वो मिले, जो नहीं आ
राइट
सकता
सर.
जो आ रहा है मेरे सामने उसको लेता जा रहा हूँ. इसलिए आप मुझे ना जैसे आएगा स्क्रीन पे आई कैन ऐड. 53 हो गए हैं, तो जैसी वो आएंगी अब उसकी क्यों सिग्नल नहीं पहुंच रहे यहाँ तक.
पागल का बच्चा.
जी बेटा बोले बोले साफ बोले ना. इज इट क्लियर? आपको बात समझ आ रही है? अभी खाली सुन रहे हो? चलिए जैसे बेटा जी Yes, speak. So, how to induction of vomiting has to be done. Vomiting induction is used to remove poison within 4 to 6 hours of ingestion. This method is contraindicated in case of ingestion of corrosive poison, risk of perforation in GI tract, chances of aspiration can be happened, ingestion of petroleum distillate, fumes may be inhaled, in cardiopulmonary disease, in cardiopulmonary disease, chances of heart failure can be happen. In case of pregnancy and children, so these cannot be, these are contraindicated in such cases. The various methods are employed for inductions of vomiting as follows. First, mechanical irritations produced in throat with finger or any linear object is applied by using emetic agents. Further, plain warm water can be used. Weak solution of copper sulfate can be used. Mustard powder 15-20 gram in glass full of water can be applied. Common salt 15-20 grams in glass full of water with mustard oil. Ammonium carbonate 1 to 2 gram in 1 glass of water. Apiquana contains amethine 1 to 2 grams with 1 glass of water or 30 ml of syrup can be used. Gastric lavage. This method is employed in case of indigestion of poison within 4 to 6 hours. Even in case of indigestion of poison above 6 hours, this method is useful. The method is contraindicated in following cases. Absolute contraindicated in corrosive poison except carbolic acid. In case of convulsions in children's, in case of coma, in case of petroleum distillate, the gastric lavage is done by using specific tube referred as BOS tube or evolved tubes. Gastric lavage tube, it is 1 to 1.5 meter long, 12 to 7 centimeter broad, rubber tube thick enough to pass through esophagus. The tube consists of following parts: funnel and to pour in fluid and to take fluid out after lavage, suction bulb to take out fluid of siphon action failed or to force, open, perforation, block, food particles. Now Tayyiba Hanif is there. So it has suction bulb to take out fluid of siphon action failed or to force open, perforation, block by food particles, low rounded, perforated end, rubber tubing, mouth gauge, its wooden structure, to avoid teeth damage and have a central large hole to pass rubber tube. Ideal tube for gastric lavage is lavicurator, clear plastic tube. How it has to be applied? Nose tip is earlobes, pharynx. It has to be applied for the gastric lavage. How? Esophagus, cardiac sphincter, stomach. It reaches to the stomach for the gastric lavage over there. Precaution in gastric lavage. The patient should be semi-prone or prone to left side. Head should be lower than hip. Ensure clear airway. Mouth gauge should always use. The first washing should be with plain water, 100 to 200 ml. Continue in stomach wash till the color fluid and or in going outgoing fluid is same. Pinch the tube before removing to avoid aspirations. Then we have done precautions. Procedure of gastric lavage. After positioning the patient, teeth are open and mouth gauge is placed. The lower end of tube is lubricated with water, soap or milk, and is passed through opening of mouth gauge till the 50 centimeter mark, ensuring that tube is passed through stomach. If cough reflex, hissing sound heard at funnel or air bubble seen in dipping funnel and in water, it indicates that the tube is entering into the respiratory tract. The first washing is done with fresh water, a small amount, 100 to 200 ml, used to avoid swapping of poison into intestine. Further lavage is done with plain warm water or potassium permanganate, 1 in 1000. Each time, 5 ml of fluid is passed into funnel held at level higher than body. After 15-30 ml, second funnel end is brought lower than the body level. When fluid from stomach came out by siphon action, the process is continued till the color and nature of ingoing and outgoing fluid is same. About 20 liters of fluid is required for whole process. It may be up to 20 washings. Other fluid used in gastric lavage procedure are 5% sodium bicarbonate in acidic poisoning, 4% tannic acid is strychnine poisoning, 25% sodium thiosulfate in cyanide, iodine, and arsenic poisoning, 1% calcium gluconate in oxalate poisoning, 2 gram per liter destroxamine in iron poisoning, 1 to 2 castor oil in warm water and carbolic acid poisoning. The poison which stick to wall of stomach, in such case, one of following can be left in stomach: potassium permanganate solution, demulcent, sodium and manganese sulfate as purgative, sodium bicarbonate in acidity or activated charcoal as absorbents. In children, gastric lavage is done with Royal's tube or rubber catheter using 20 ml or 50 ml syringe to push in or take out fluid from stomach. Usual length of tube is 30 centimeter. So gastric lavage is contraindicated in aspiration pneumonia, vomiting, injury to mucosa of throat, rarely perforations.